Hospitalizations are rising, and we must be proactive in protecting our healthcare system and ensure we have hospital beds available to continue to provide care for patients in need.
COVID-19 cases are climbing in the past 4 weeks, especially in the southern health region of the province. While Manitoba sits at 84% of fully vaccinated residents, it is the age gap between 0 and 19 that is seeing an increase in cases. New COVID-19 measures are coming into play and will take effect as of 12:01 a.m. Saturday. The majority of the province will remain in code orange with no changes for those who are fully vaccinated, only affecting those unvaccinated in Southern Health Santé Sud.
So the religious gatherings are limited to 25 persons, unless the facility can physically divide their space into separate areas, in which case you can have several cohorts of 25 individuals. The total number of attendees at a service may not exceed 25% capacity of the facility to a maximum of 250 people. Again, that can only be achieved through the use of cohorts if the overall capacity allows. So those cohorts must be separate. They must not mingle in any way. They must have masks on at all times, and distancing rules apply. Numbers provide us with a range of possibilities, but without any further restrictions, we see the upward trend in Manitoba. We see that this model here at about the 50% range would give us about 200 cases a day at the beginning of December.
Monica Warren says the numbers coming out of the Southern Health region are alarming.
In the past week, 15 COVID patients have been admitted to ICU, including 2 yesterday. As of midnight, there were 86 patients in our ICU, and this number includes 30 patients with COVID, which constitutes a jump of 25% just this past week.
We see numbers translating upward in diagnosed cases. That's going to translate into increasing ICU admissions. We see here that this model at the mid-range of the predictions of this model would be predicting about 3 ICU admissions per day by early December and climbing thereafter. And what we've seen in previous waves, that's not a sustainable number.
By December, Rusin says 40+ people could be in ICU with COVID, which will put a strain on our healthcare system.
Overall, there were 145 patients hospitalized due to COVID in Manitoba, and this again is up 27 patients, or nearly 23% from 1 week ago.
The province's hope is that Manitobans needing ICU care, aside from COVID, can continue to receive that care in hospitals close to them, and that the 4th wave doesn't disperse people from getting the care they need. In Winnipeg, Brianne Foley, City News.